Tapestry. My name is Napoleon Bell, and I'm the Executive Director with the City of Columbus Community Relations Commission. I'd like to welcome you to the show, and I'd like to welcome my co-host, Miss Toni Teague.
Hi, it's good to be here again.
Definitely by the side, because we've got a lot of great things that we need to talk about today and a lot of interesting items to really discuss that are out there to really help people that are in need of our help.
That's what our show is all about, making sure that we highlight the good things that are going on.
Exactly. So I tell you what, why don't you just take it from here and introduce our first guest.
Thanks, Napoleon. Adam Lanza, December 14, 2012, who shot and killed 26 people, consisting of 20 children and 6 teachers in Newtown, Connecticut, had a mental illness. Aaron Alexis, who went on a murderous rampage at a U.S. naval yard, was suffering from schizophrenia. Reports say that his symptoms fell just short of being in need of help. Are we waiting until people are pushed past the brink to make light of the need? By that time, it's too late to help them and too late to give the positive PR needed to recognize that mental health-related issues do not make people modern-day lepers. Here to discuss some of the positive steps that are being taken in our Columbus community to dispel the myths about mental illness and invite you, our viewing audience, to be part of the movement that matters is Rochelle Martin, CEO of NAMI Columbus and a member of SAMHSA. Welcome, Rochelle, and welcome, Yvonne.
And thank you for having us.
Thank you.
You are very welcome. You two are sheroes in our community because you are really working on an issue that sometimes is underfunded. It's definitely underpublicized in those positive ways. So what's driving you to be part of it?
Absolutely.
Well, in January 16th, 2013, President Barack Obama had brought to the attention of having people to come together to have community conversations on mental health. It is a serious issue that he wants to have discussion on. And in response to this issue, there was a community, creating community solutions, which is the key element to the national conversations. So the city commissioner, Fran Frazier, asked NAMI Franklin County if we would be willing to be the host for the community conversations, where we are going to bring all community people together to discuss the very issue of mental health in our community. And Yvonne is one of our planning partners, and she is the executive director of the Human Services Chamber, where there are how many?
70.
70 not-for-profits that work with us, that work in the community. We partner on a number of issues. So a number of the planning members will be available, and we're going to have this massive conversation at the Columbus Public Health. The kickoff is October the 10th at 5:30 at 240 Parsons Avenue.
And everyone's welcome?
Everybody is welcome.
All right. So you've got a number, after the kickoff, there's some other things that are going to be happening because I think I hear so often people say, we don't just want to have a conversation, but the conversation has to start somewhere. Where else will you be taking these conversations?
Well, the planning committee designed the structure in such a way that every part of the community in Franklin County, well, in Columbus, East Side, North Side, West Side, and the South Side will have conversations. And also we will have 3 additional suburban communities. Oh. We're going to have Grove City, Reynoldsburg, and Worthington. And the kickoff will be on the 10th, like I said. The next meeting will be, they will have to have 2 other conversations in their community. So the first one will be the kickoff. They will have the conversations there, and then they go back into their community to have the conversations. We will have everyday democracy facilitators to facilitate the conversation. We have a proposed leader and a host of the particular community that is in charge of bringing the people from that particular community together.
Well, let me ask you this, because, when people think of mental health or mental illness, well, what are the types of mental illness, and, what are we looking at here? Because what one person's idea of mental illness might be something else. What types of mental illness do we see most prevalent here in the city of Columbus?
Well, the major severe mental illnesses are schizophrenia, bipolar, post-traumatic stress disorder, better known as PTSD, anxiety, major depression, OCD, which is compulsive, obsessive compulsive disorder. Suicide is a major issue for our community as well.
Now, I see that you have a track for young people.
Yes.
That's a great thing, because you see, and Toni alluded to some of those things in the intro about young people doing crazy things. Just doing those things that you wouldn't normally do. So what how is that being addressed, or are we, like we was talking about, are we too late and really realizing this, or what?
Well, I don't think we're ever too late.
No.
And I think part of these community conversations that are established in the 9 neighborhoods that Rochelle mentioned will give young people, particularly the transitional age young people, ages 16 to 24, an opportunity to have an outlet. Oftentimes what we're seeing is this explosion of a lot of anger issues, a lot of other issues that are lying dormant, because at some point no one is asking them what's wrong. It's just having a conversation with them. So the community conversations will be an opportunity for them to be able to say what's on their mind, and for them to be able to identify opportunities and resources in the community to get the help that they need.
Well, Yvonne, what are you hoping the outcome of these conversations is going to be?
I hope, and I'm very confident that we're going to, one, raise the awareness. As Rochelle mentioned before and highlighted some of the areas of mental health, there's another shift that needs to happen too, and we need to continue to pad our community with wellness of care. We need to talk about mental health illness in a different capacity so that people don't understand that it's also a matter of nurturing and providing resources to families when they're in need. I also hope that our community will continue to come together and understand that we can't do this in silos. It has to be a part of the family structure. It has to be a part of the education structure, and then having the city and a number of our nonprofit organizations who are members of the Human Service Chamber of Franklin County involved as well.
Now, would you say it's the unpredictability of mental illness that might be making people afraid, and again going back to that issue of possibly the modern day lepers?
Well, what I think, Toni, is that people are just not aware, and they just don't understand. And so I think conversation about the myths, the misperceptions that people have is important to really discuss that.
And particularly in communities of color, too.
Yes.
We hope, too, this conversation would uncover and remove some of those barriers in communities of color where we stigmatize mental health as a problem and take it from must be something wrong to you getting and identifying help when you need it.
It may not be a forever issue, and I think that's one of the challenges that I see when people talk about mental illness. It could be that it's just an isolated incident, and it may just be brought on by a season. And with therapy and medication, the person would be able to go back to live life as they were before the incident. And for some, it's an ongoing issue that they will have to address throughout the course of their lives. What would you say is the best course of action, in addition to what you're doing with the conversations through SAMHSA? what else needs to be done?
Well, I think that as long as we make people aware and make people understand the signs and the symptoms that people might have, and know that that these issues do exist.
And is that going to be part of the conversation?
Well, I hope so. I hope that it will get to that where the facilitators will bring out that kind of information. But people, I want you to know that families are living in serious isolation here because they have a loved one who is suffering with a mental illness. What about the person with the mental illness? They are also suffering and need help and direction and guidance.
What about the access to health care? I mean, because that's always, a problem with many. So what do we do about that, or are we looking at how do we address that? Are there going to be those health professionals there to really be a part of that conversation?
Oh yes, there will be health professionals. You know that the Adam Board funds a great deal of healthcare professionals that we are inviting as well to be a part of the conversation. But you understand that that our system is kind of suffering because we don't have the resources that really are available to take care of these issues. So we really need to have that additional funding. Where's it going to come from? But that is a very important issue.
So it sounds like you're probably going to be taking an approach to gather information, to collect some data.
Yes.
And then where will you take that so that you can get some advocacy and some funding?
Absolutely.
Well, there is on October the 31st at the Columbus Public Health will be the action forum where people who have been through these conversations will come back together and talk about what they learned, what they discussed in their conversations. And so then there will be some possible funding for their specialized ideas that they came up with.
We're all affected by mental health issues in one way or another, whether it's ourselves or someone we know or a loved one. And even if we're not aware of that in someone, we are affected.
That's correct.
That's amazing. I'm glad to see that you've thought the whole process through. Now, tell us who else is going to be at the events. Will you have officers there? Who all, when you think about the community being at each of these 9 events, who should participants expect to see in the audience that can answer some questions and keep the dialogue going?
And in addition to that, also, how do you get involved? People who are watching this says, I want to be there, or I want to be at one of these conversations.
Yeah.
How do they get involved?
Absolutely. Well, I think what we're hoping is that the conversations are open to the public, and we would like to attract both the usual and unusual suspects to the table. We want law enforcement individuals present. We want the community librarians present. We want young people there. In Reynoldsburg, where I'm a resident, I am very proud. We are partnering with Kitty Academy, which is led by Carol Haynes. And so what we hope to do is open the opportunity for other parents and families to get involved as well.
And we hope to have providers, agency providers, social workers, case managers, psychiatrists. We hope to have the whole gamut at the conversation, and where they can sit in on their own community conversation and work from there.
Now, you said that the facilitator is going to be someone trained in the everyday democracy method.
Yes.
Can you tell us a little bit about what that is?
Well, Fran Frazier is a member of the Everyday Democracy, member of their staff, and she has trained a number of individuals in everyday democracy. And so those facilitators will be on tap or on hand to work with the communities. And she actually finished up a training today with the second set of facilitators. So we're hoping that we will have at least 15 facilitators to work to. They will pair up and work with the community.
This sounds like a movement that has all the makings of becoming sustainable,
Yes.
and that's really wonderful. It's like each one is teaching one and
Yes.
really having conversation, which is something that needs to happen.
Well, and with that, do you look at, I know you're talking about the 9 meetings and then coming back and kind of putting the data together, but then after that, what's the long term?
Absolutely. I think part of one of the long-term strategies would be impacting public policy. Napoleon, you mentioned how do we sustain this and how do we increase access for families. And part of that would be we have to bridge what's happening in policy but what is happening in practice. And so when families are hurting or when the community says that they have certain needs, we need to make sure that our elected officials and those folks who are in charge of decision making understand that we need to, as Rochelle mentioned before, build out the funding and the resources to be able to provide those additional services.
And we are hoping that both of you will be there to take part in that kickoff.
Well, I actually think that's very possible because when you mentioned the training, actually one of my staff persons, Neil Simmel, has gone through that training. He's actually our lead diversity and cultural competency trainer. So I'm looking forward to seeing him at work, at the kickoff there. So and throughout the conversations. So that's great to hear. But yes, I think that's something that we can definitely do, or at least, or especially be part of one of the events out in the community. So I have to find out which one is close to where I am.
Yes.
Yeah, that's great. Wow. So we got to wrap up here, though. But so let me ask you this: if somebody wants to be a part of it, and get whether they get registered or what have you, and then also go through the list of where you're going to have the conversations at, that'd be great. So or if you have it on a website too.
We have a website. We have a Facebook page that we created particularly for the event. So go like us on Facebook.
Where at on Facebook?
Well, on our Facebook page, it's our website is www.namifc.org.
Okay.
And then I'm with the Human Service Chamber of Franklin County. You can access the Facebook page through our website, which is www.humanservicechamber.org.
Humanservicechamber.org.
And so all the planning committee people have it on their websites, and so we can get it from there. So
Rochelle Martin and Yvonne Honeycutt, thank you so very much for being our guest. We are so very proud of the work you're doing.
Yeah.
Thank you.
Thank you.
Thank you.